Well, thank you, and welcome everybody. It's a great honor to be able to come up and speak on behalf of all of you for our great friend Chris Zachary. We first met at St. John's Hospital for Diseases of the Skin 25 years ago. Chris Zachary was the leader of the bunch. Clive, who you just met, was one of the senior registrars, along with Colin Holden, one token female, Gillian Murphy, who held her own amongst the boards, that's for sure, Tim Sonics, and Jan Hirschman, who was an internist who came from Seattle to spend 6 months with the group. And Chris loves to entertain, as you all know. And he hasn't changed at all in 25 years. In fact, he was wearing this tie this afternoon when I saw him at Congress. He loves yellow ties. And these are his girlfriends. He had 4 girlfriends and 1 boyfriend at the time. That's Richard now. And here he is leading the band. This is the Christmas pageant at St. John's 1984, 25 years ago. And this is his brother, Richard, who's a relative of the Unabomber, I think. This was the venerable St. John's Hospital. It was in Leicester Square. Some of you have been to it, I'm sure, right in the theater district. There was a brothel in the building just off to the left. Clive promises me that he never went with Zach when Zach would go. It was a beautiful gabled Dutch building in the heart of London. And when I left in 1985, I left it in Chris's able hands. And I went back recently and look what happened. The building changed color, and the name became the Crooked Surgeon. This is true. Chris, what happened? Chris likes yellow bow ties as well as yellow straight ties, and he loves to entertain, as you all know. And he's a brilliant teacher. I've been asked to talk about his teaching skills. And having run controversies with Ross and Ken over the years, we've been witness to some of Chris's vintage educational efforts. This was the title slide of one of his talks a few years ago when Thermage first started. And Chris wondered if non-surgical skin tightening was effective. This was his first slide. Anchoring points. My almost 18-year-old daughter said, "You're not really going to show that picture, are you?" But it's Chris's picture. And I'm not going to name who was the founder of this concept of anchoring points, but he will remain nameless. But Chris was going after one of our faculty. This was his talk last year, and it was entitled, "Where My Dog Peed." And these are Chris's feet. And that's where his dog peed, right in the middle. And here's a close-up of the pee. And the pee made the grass grow greener, and that's the way fractional resurfacing works, at least the way Chris figures it. Now, I don't know who this is on the left, if that's Chris's dog or not, and what he's doing holding all this poop in his hand, and what this has to do with fractional resurfacing, but he's a great teacher, and we learned a lot from this slide, I think. Now, one of Chris's favorite Englishmen is Oscar Wilde, who said, "A gentleman is one who never hurts anyone's feelings unintentionally." And I think that speaks volumes of Christopher Zachary. Louis Neisser said, "A graceful taunt is worth 1,000 insults." He must have known Chris Zachary. Here's another one of Chris's title slides, "Industry and Research, Who's Wagging the Tail?" And you know Chris loves poetry, so I'm going to recite some of Chris's original poems for you. Who's wagging the tail? Here on the podium with Ken, Robs, and Jeff Dover, I'll be critiquing things laser, yes, and moreover, for some it's a nuisance, my little puissance. But this is my chance to win you over. With our little clique here at Mont Tremblant, and our Chateaubriand with Dom Perignon, I might burst a few bubbles, cause a little trouble, especially for some. So let's bring it on. The Association of Physicians and Business Technology is good, established, and needs no apology. But developing good science and the right alliance might require a doctor of theology. These are all Chris Zachary originals from Controversies. I'm sorry you all haven't been there, but now you have a really good reason to come, because Chris is our most promising speaker. Laser surgery is in a sad state, said Christopher Zachary. Hyperbole, lies, illusion, mass hysteria, folie à million, companies, media, physicians, we run the risk of losing all credibility. It's important for us, I think you'll agree, to examine our deals with the laser companies. A hearty discussion might have repercussion and affect critical thinking of us meeting attendees. Today's most exciting laser production will result next week in a NASDAQ eruption. No need to take Paxil, just invest in Fraxil and take an incredible business deduction. Another one of Chris's title slides, which non-ablasive lasers will survive, which will die. Compare with statistics for human mortality. The first 5 minutes of life are the most dangerous, and the last 5 are a bit dodgy too. Now you're laughing, but the company whose slide came up next wasn't laughing, but I'm not going to show that slide or the litigation that follows suit. Patients and doctors may have unrealistic expectations, said Dr. Zachary more recently. When Bob Hope was asked by his wife where he wanted to be buried, he said, "Surprise me." Chris likes to make fun of the before and afters on the web, and I'm going to be very careful not to name any of the companies that Chris has gone after over the years. Am I wrong? Is this an error? Or are you too frightened and sulking with terror? In this does she purse her lips and then reverse to relax and be calmer than ever? Good news, dear patient, after critical review, we can endeavor to make you new. With this device, for quite a price, I promise to change you a micron or two. And the last, here in this image, the muscle is plain, and now it is gone like a spasm of strain. I might be deluded, but I have concluded that she passed some gas and got rid of the pain. These are all Chris Zachary's. How about this? Energy sources and cosmeceuticals, success by one means or another. And this is not tea in our ulster. No, it's not. Dr. Albert Kligman once said that the intelligent Harvard graduate with a PhD can't make a sensible choice when she goes in and looks for a good moisturizer. And as you all know, he coined this term 25 years ago, cosmeceuticals, to refer to a class of creams that does more than decorate or camouflage and less than treat a disease. Well, this is Dr. Zachary's approach to the cosmeceutical world. Natural evolution of safer devices with progressively less efficacy have been developed. We should find a class of lasers and light sources called laserceuticals, cosmolyticals, lightceuticals, or the best of all, cosmical lasicals. Comical lasicals. And here the best of all. When I was a boy, I had the ambition to grow and be something, maybe a physician. But I'm a trendsetter. Now I can do better. I'm coming out. I'm a cosmetician. Some cause happiness wherever they go, and others whenever they go, said Oscar Wilde. Chris Zachary is clearly one of the former. I'd like you all to stand and raise your glasses to toast a wonderful guy, prince of a guy, my very close friend, Chris Zachary. To Chris Zachary.